Now to our top story tonight, a COVID-19 outbreak at Providence Portland Medical Center. We know roughly 50 people, both patients and caregivers, tested positive, and now a medical unit there has been shut down. Our Camila Ortiz is bringing us the newest details on this outbreak and spoke with a nurse who works in that building.
Providence says the outbreak was discovered on December 22nd. It happened here at the Northeast Portland location in a fourth-floor ward, completely separate from the COVID unit. That's according to a nurse I talked to. That nurse says he's hoping this helps the hospital see that he and his coworkers need some additional protection. Providence, Oregon is investigating an outbreak of COVID-19 at Providence Portland Medical Center that infected 13 patients and 36 staff members between December 22nd and December 31st.
I think it was inevitable at some point in time. We're a big hospital.
Richard Botterill is an emergency room nurse at Providence Portland. He tells me the outbreak happened in the 4K unit, which is an 18-bed rehab section of the hospital that does not deal with COVID patients. That unit is getting deep cleaned and remains closed. According to Providence, 217 caregivers were tested who either worked on the unit or came into contact with patients there. While hospital staff are very strict about PPE protocols, Botterill says part of the problem that could increase the risk of spread is that nurses often float to different units depending on the hospital's needs, and he thinks Providence could have done a better job with communication after that very first case was discovered.
Communication to some of those float nurses didn't happen perhaps in the time it could have happened.
He also told me he wants to see protective measures beefed up across all parts of the hospital, not just COVID and ER units, telling me all nurses and doctors should have access to N95s and more regular testing.
We get tested if it is deemed that we have been exposed. And that typically means, have we been around a patient for maybe up to 15 minutes? Have we not been wearing our N95? Have we not been wearing our face shield?
Because it could take several days to develop COVID-19 symptoms, or you could have none at all, Portland State University professor Ken Stedman agrees more rapid testing could help curb outbreaks.
One of the big problems, of course, with SARS-CoV-2 is you can spread it before you know that you're sick.
Providence says it's also doing genomic testing to determine what specific variants spread and that no new cases have been tied to this outbreak. Providence also says all 13 patients who tested positive were either asymptomatic or had mild symptoms, and that 24 of the 36 caregivers who tested positive are already back at work. The Oregon Nurses Association organized a caravan that's going to take place tomorrow afternoon, and this is to push for more testing, faster notification, and additional emergency leave for staff members. That starts at 1 o'clock along Northeast Halsey. In Northeast Portland, Camila Ortiz, Fox 12 Oregon.